ever been driving in a car down a highway and just realized that you have missed your exit? Were you distracted or lost in your thoughts? Well, answer to this lies in your brain. In this video, we will explore the functions of brain using magnetic resonance imaging or MRI as a guide. Through stunning images provided by MRI, we will uncover the inner working of this amazing organ and how it controls the working of our everyday life. But first, if you have missed our previous video or this is the first video you are watching, you may want to go back and watch the video where I have discussed the development of brain and various parts of the brain in much more details. So let's continue our journey into the depths of human brain. Let's familiarize ourselves to MRI images. Here I have taken a coronal section from T1 weighted MRI scan. Before going into the details about brain anatomy, let's see some basic structures which we can identify. Starting from the skull, it has the outer table and the inner table. Here you can see the dura mater, and sandwiched between its two layers are the dural venous sinuses. Actually, you cannot differentiate between the dura mater and arachnoid matter in this images. So what you can see beneath this matter is the subarachnoid space filled with CSF, and the CSF you can see is running into the sulci of the brain. Over the brain surface there is a pia matter which I have outlined in this image. Now into the brain you can clearly see the differentiation between the grey matter outside and the white matter inside, and here you can see a lining which is separating the two matters. Then at the core of the brain you have the ventricles which are filled with CSF, and you can see the color of both CSF in the subarachnoid space and the ventricles is matching. And just for the recap, the depressions on the brain surface are called as sulci and the elevations are called as gyri, and the sulci divides the brain into different lobes, and here are the three different sections of the brain: the coronal, the axial and the sagittal sections. Here what you can see is a 3D reconstructed image of the brain, and I have also added labels of various functional part of the brain over it. We will see some of these areas in details now. You can divide brain into multiple parts and its anatomy and functions are endless. Here we are going to focus on the 9 most important functional aspects of the brain and its related anatomy. First, let's see the various sulci and gyri on the cerebral cortex. So we have seen that the central sulcus divide the brain into frontal lobe and parietal lobe. Just anterior to the central sulcus you have the primary motor cortex which is located on precentral gyrus. This is the area where neurons forming the descending motor tracts originate, and they control the voluntary muscle action of hands, limbs and face. Bulging of this gyrus into the central sulcus forms an omega sign, and this region controls the hand movement. This area also continues on to the medial side. Immediately in front of the precentral sulcus, we have supplementary and secondary motor cortices. They help in planning of motor movements. Now, the anterior portion of this Sylvian fissure divides the inferior frontal gyrus into pars orbitalis, pars triangularis and pars opercularis. From this, the pars triangularis and pars opercularis forms Broca's area in dominant hemisphere, which is left hemisphere in most of the individuals, especially the ones which are right-handed. Functionally, the Broca's area forms the motor aspect of the speech, and injury to this area leads to Broca's aphasia or motor aphasia, where a person has difficulty in articulating the language. Remember, Broca's area is present unilaterally in the dominant hemisphere. Going more anteriorly, we come to the prefrontal cortex. By far, this is the most important and most evolutionary advanced part of the brain. It is the site for higher cognitive functions like intelligence, reasoning, goal-directed behavior, and it is also a site for memory storage and memory processing. It basically controls and defines a person's behavior, and logically it is also involved in many psychiatric diseases like depression and addiction. Posterior to the central sulcus is your parietal lobe. It is involved in the sensory processing, and the gyrus adjacent to the central sulcus is called as postcentral gyrus, and it represents the somatosensory cortex. It is the site where all the ascending tracts from various parts of your body ends. These tracts carry the information regarding various senses from the skin like fine touch, vibration, joint sensation, joint position, and even pain. Posterior to this gyrus is the sensory association area. At the back end of the brain, we have occipital lobe, which is separated from the parietal lobe by parieto-occipital sulcus, which is mainly seen on the medial side. Functionally, occipital lobe is involved in processing visual information. Here we have the primary visual cortex at the occipital pole, and surrounding it are the secondary visual areas. Now on the medial side, we have the calcarine fissure, and the area between parieto-occipital sulcus and this fissure is called as cuneus, and this tongue-like structure in front is called as lingual gyrus. These two structures are extremely important for the higher level visual processing, verbal memory, and cross-modal sensory integration. Temporal lobe is separated from the frontal lobe and parietal lobe by Sylvian fissure or the lateral sulcus. However, the demarcation between temporal lobe and occipital lobe is an imaginary line. Before we see what are the functions of temporal lobe, there is the part of cortex which is present between the frontal lobe and temporal lobe. This is called the insular cortex. In a physical brain, you actually have to separate the frontal lobe and temporal lobe to see the insular cortex. Insular cortex has representation of taste or gustatory sensation. The temporal lobe has the area of primary auditory cortex and auditory association area. The posterior part of temporal lobe has special area called as Wernicke's area, again present only on the dominant hemisphere and involved in language comprehension and understanding the spoken and written words. It is connected to Broca's area via arcuate fasciculus, and damage to this area causes Wernicke's aphasia, where person has difficulty in understanding the spoken and written language and also forming the coherent replies. It is also called as sensory aphasia. On the medial surface, you can see this C-shaped structure which consists of thick bunch of white matter tracts. They connect the two cerebral hemispheres and are called as corpus callosum. Superiorly, parallel to corpus callosum is the cingulate gyrus. Together with hippocampus and amygdala, this structure forms the limbic system, and limbic system is extremely important for the emotional behavior of the person. On the medial aspect of temporal lobe, you can find the hippocampus, which can be better appreciated on coronal section. The area surrounding hippocampus is called as parahippocampal gyrus, which is separated from hippocampus by hippocampal fissure. They play a central role in memory. They consolidate the short-term memory to long-term memory by a process called as long-term potentiation. They also help in memory retrieval, as many of the cell bodies of neurons are present in the cerebral cortex. It is called as grey matter, while the myelinated axons forming the tracts forms the white matter. However, there are some collections of cell body present deeper within the cerebrum, and they are called as nuclei. So, the collections of cell body within the CNS is termed as nuclei. Let's explore some of these nuclei present deeper within the brain. Basal nuclei are the deep cerebral nuclei involved in fine-tuning the motor activity. They consist of caudate nucleus, putamen, globus pallidus, internus and externus, subthalamic nucleus, and substantia nigra. These structures are important for programming processing of motor input from cerebral cortex. They are also important for emotional aspects like motivation. In substantia nigra, we have dopaminergic neurons whose activity is affected during disorders like Parkinson's disease, where they present with symptoms like involuntary movement, difficulty in initiation of movement, unstable gait, among many others, and this disorder is treated by giving dopamine. They are also involved in other movement disorders like Huntington's chorea. Then we have thalamus, which acts as a sensory relay station and sorts out the various sensory information. Here you can see only that, the thalamus is present on side of third ventricle. The structure between thalamus and basal nuclei is called as internal capsule, where all the descending motor tracts go down to the brainstem and spinal cord. It is important to know about this area, as a small hemorrhage or an infarct in this area will result in paralysis of half of the opposite body. Finally, we have hypothalamus, and connected to hypothalamus is the pituitary gland. This seemingly small structure is center for many homeostatic activities in the body. It is the highest center for the autonomic system. It regulates both the sympathetic activity and parasympathetic activity, and thus regulates the heart rate and blood pressure of individual. It also acts as a main center for endocrine activity, and it is intricately connected to the pituitary gland, both the posterior pituitary and the anterior pituitary. It sends neuron down to the posterior pituitary, where it releases the vasopressin and oxytocin, while it releases hormones which regulates the activity of anterior pituitary. It has a very good vascular supply between these two areas. Additionally, it has centers which regulates the general bodily functions like thirst, hunger, satiety, and finally it is involved in regulations of emotion by being a part of limbic system. There are many more structures and more specific tasks or functions of the brain which we will discuss in coming videos, but for now, the 9 most important functional aspects of the brain we have covered. Hope you have found this video informative and fascinating, and you have enjoyed watching it. If you want to stay up to date with our latest content, please consider subscribing to our channel. Keep following us to have deeper understanding for the complex working of a human body. Thank you for watching, and let's meet at the next video.